Ma says, please lobby to add required substance abuse screening protocol to the appropriate age groups, as it could save a life and diagnose depression, etc., just like vaccines, eye and dental checkups. This is prudent considering the epidemic of depression, suicide, overdoses, and substance abuse, Rob.
So this has been a practice that has gone on many different places, and there's been different forms of legislation with this. But the same way that we universally screen kids for ELA and math, which is what the math assessments are from NWEA, we also need to screen our kids for being behaviorally at risk, and then have those same tiered interventions in place for kids who are experiencing a crisis. And what falls into that is also the substance abuse screening as well.
All right, David said, how is it that school districts needed more money from the American Rescue Plan when we pay the highest school taxes in the country? Where is the money going, Kara?
So yes, we do pay property taxes, and that's why the funding from the federal government is so important, and we want to advocate that it continues. I would encourage this individual to take a look on their district's website, look at the specific school budget, and look at how the ARP funds were used. But we're going to continue to advocate for more. And I wanted to touch back to what Rob said. As far as doing screenings for kids, our schools are the centers of our community. And if we can get the funding to continue to expand programs where parents can get resources and mental health support, and if someone has an addiction issue, we can provide those resources for them, that would be amazing. So I don't want that to come out of your tax budget locally, but I think that's something that we should continue to advocate for at the federal level.
And Rob, when we talk about those American Rescue Funds, there's a certain period of time where all of that, has to be spent. So what happens this year?
So we still have money this year, but then, what's going to hit everyone next summer is, those extra interventionists that we hired to help support students who had regression. Are we going to be able to fold that into the budget, or are those positions going to be cut? And if so, are they going to get cut in that crucial year where we're trying to make that last year of growth to remediate what happened from the pandemic? So, I think that's going to be a crisis point this time next year as we try and figure out how do we handle that.